Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Dr. Paul Caselle, whose speaking presentations and training programs focused on adult orthodontic options that take the uncertainty out of treatment and make limited orthodontic treatment fun and rewarding, which is quite a promise. That sounds awesome. Today we're going to be talking about his course, Orthodontics for the General Dentist. And Paul, could you get us started by helping us understand what's happening for the dental professional in their practice life that this course will help them be able to grow their practice by learning more?
Well, very often we see patients that come into the office and they have orthodontic relapse. I have patients come to me and say, my teeth are moving, they're shifting. And had braces when they were kids, and obviously they stopped wearing the retainers. Mm-hmm. So they're looking for a easy way to correct this movement. And sometimes we have patients come in, they never had orthodontics, but they have teeth that are slightly rotated or overlapped, and doc, what can you do to help me out? So we would refer patients to the orthodontist, and they never went because they come to you. If you can do the treatment in the office, they're more than happy to have you do the treatment. And so way back when, before all these treatment modalities that came out, you were left with doing veneers or crowns, and a lot of people thought that was too invasive. So now orthodontics gives us a non-invasive way to straighten a lot of these teeth that don't look all that great, and the results have been amazing. People are extremely happy when they finish the orthodontic treatment.
Very good. So they then they trust their dentist. They'll be more likely to get this treatment that they need, as we're saying by the general dentist offering this. Can you share with us in more detail what is covered in this course?
Well, I talk about the different clear aligner systems that are out there. I also talk about 6-month smiles, which is using tooth-colored wires and clear brackets. Sometimes that type of technique is a good technique to use when you have teeth that have the rotations or the type of movements that clear aligners are a little bit more difficult for clear aligners to make. And so you have to look at each case and evaluate the case. And we talk about evaluation, which modality would be the best to use in each particular case so that you can have predictable results.
Do you share case examples, or how are we learning?
Well, I will show examples of each of the modalities and how they're done. I'll talk about 6-month smiles and what's involved with that. And I'll give them examples of how when you do orthodontics, it very often leads to other treatments, such as maybe phenectomy at the end of treatment or gingivoplasty. And that's a great place to use a laser. So if you have a laser in your office, you can do the cosmetic enhancement. Also, the ability to whiten the teeth at the end of treatment. We talk a little bit about whitening and the different modalities for whitening, because very often people want to have a beautiful smile, and doing some enhancement at the end through whitening or even veneers using CAD/CAM systems. You can do a veneer to help correct a tooth that's been misshaped because of years of abnormal wear.
So let me just make sure I'm clear. I think what I'm hearing is that we would then talk through the different options for treatment, and you'll give participants some guidelines and principles to use to be able to help them determine what would be the best course of action for the patients, the different levels of orthodontic treatment, whether they are referred out still for something like a 6-month smiles, or what they could complete in their own office.
Okay, well, I talk about clear aligners. So we have 3 different systems of clear aligners. You have MTM, you have clear correct, you have Invisalign, 6-month smiles. I'll talk about each of those modalities and which one you can use in different cases. Give examples of cases of which ones we'll use in each case, so you can see how you make that judgment and help you select the right modality to get a great result.
Excellent. Now, is this course best suited for the dentist and their clinical team, I'm assuming then? Who's our attendee?
Well, the attendee would be primarily the dentist, because the dentist a lot of dentists have had exposure to orthodontics, and they sometimes get a little frustrated because they don't see the movements really happen the way they expect.
Mm-hmm.
And sometimes treatment takes a long, long time. So a lot of times it's predicated upon, which modality you're using. If you use a modality and have some certain guidelines that help guide you in which modality you use, will allow you to be more successful. It's great for the clinical staff because we all know patients tend to talk to the staff first. They'll say, can your doc fix this, you think? And if they know about the options in the office, they can help answer the questions patients have and make them feel more accepted of treatment.
Oh, that's a good point. Well, now, Paul, before we have to be done for today, is there anything of importance that we haven't talked about in this course that would help the event planner to know?
Well, a lot of people don't talk about orthodontics for the GP. And I think it's helpful for GPs to consider this, because when you look at trying to boost your productivity and you have patients who really want to have it, but they're not prepared to go to the orthodontist. And obviously this course is designed for the adult population. I still tell dentists, you're going to send your children out to the orthodontist because they really need to have their growth and development managed by an orthodontist who has that particular level of expertise. We'll talk about the adult patient who wants some cosmetic enhancement most of the time and try to get their teeth lined up in a better way so they can better maintain their teeth and prevent any periodontal disease or decay going forward. So that's important. I think you don't see too many orthodontic courses for GPs. Mostly it's geared to orthodontists.
That's a really good point. And I'll just add a little to that. With my years of experience working with meeting planners and speakers, that I think what's inherent in that is that this feels like it's something that's newer than. It's not something we see. If we don't see a lot of it, for those event planners who reach out to the Bureau and ask for what's new, what's different, this would fill that bill. So thanks so much for sharing with us today, Paul, being here and sharing with us about your course. And for the event planner who would like to find out more about Dr. Paul Caselle's courses, please visit dentalspeakersbureau.com and feel free to reach out. We'll get you in contact with Dr. Caselle, and then you can talk about customizing a program for your next meeting. So thanks for tuning into The Buzz, and until next time, be well.